Hello, my name is Candace Jarzombek, and I'm a graduate research fellow for the Collaborative Improvement and Innovation Network to Advance Care for Children with Medical Complexity. Today I'm talking to representatives from the Kentucky CMC CoIIN Team about the benefits of telehealth for their patients. Prior to March of 2020, Team Kentucky had started using telehealth to facilitate virtual care team conferences where primary care providers and subspecialty physicians meet with a patient to collaborate on a shared plan of care. During the pandemic, the team used this framework to expand their use of telemedicine. Can you both go ahead and introduce yourselves and your roles on Team Kentucky's CoIIN team?
Hi, I'm Donna Croslin. I am the nurse administrator in the Bowling Green office. I'm also assisting with Paducah. My role there is to help with care coordination with neurology, autism, and we also have otology clinic. And that's it.
My name is Davenna Bales. I'm the nurse administrator for the Somerset office of the Office for Children with Special Healthcare Needs.
I'm Sondra Gilbert, and I'm the director of our Family to Family Health Information Center and our parent to parent affiliation for the state. And I'm the parent consultant for the Office for Children with Special Healthcare Needs. It's all combined into one, and I cover the whole state. And I've been helping Donna in Paducah as well with the families to make sure that they're getting the resources and the services that they need for their children. Of course, I do that for all of our families within our 11 offices. That's my role. I'm a parent of children with special needs as well.
So, how did having the foundation of using virtual care team conferences prior to the COVID pandemic influence your shift to using telehealth during the COVID pandemic?
Well, I think it doubled the telehealth visits that we were doing when COVID started versus what we were doing prior to that, from what I remember of the numbers that we were looking at. And I think it's really helped a lot of the families as well, because based on, some of the conversations that I've had with other families and based on my own experience with having to do telehealth with my own children, because we couldn't travel to those appointments, I'm telling you, it saved me a lot of time. It saves money. It saves childcare expenses because you don't have to find somebody to stay with your other kids while you bring them in for an actual face-to-face visit. The kids are usually more comfortable because they're at home and doing it. We have less meltdowns, I think, on the telehealth than what we would have in an in-person clinic. And then that gives us, as the, family working with the other parents, a chance to get in touch with them by the phone after their visit to see if there's anything that we can help them with as well. So, you're talking time, money. I know when I take my kids for an appointment, I have to have somebody sit with my dogs because we have to drive 4 hours to see our specialist one way. So we're gone 8 hours just in drive time, and you can't leave the dogs in the house that long by themselves, So, their families aren't having to look for transportation, because some people don't have transportation, so they have other people take them, so they don't have to ask other neighbors or friends or families to take them to those appointments. They can do them from home, and I think it's less stressful.
Yes, I think from the point of view from where we started at, when we first started, we had the patients actually come into our office and they would use our equipment there. And then the physician would still be, at his home office. So he would be in Louisville in our case, and then the patients would have to travel to our office initially. And I had always thought then, that it would be nice if we could get to a point where they could stay at home or go to their pediatrician's office and Zoom in with us because of the travel at that time. And we learned through that then we had to carry it over when the pandemic happened, is some of the things that it taught us was a lot about patience, because equipment is going to fail. It is going to go down. You're going to get the robot thing that's going to happen. One person's may work and the physician may be totally off, or you can't see him, but you can hear him. So it really taught us how to begin to work through that process and to work through it with families. And so many of our families got to see that. So I think it wasn't quite as intimidating when we then reached out and said, now we're ready to start this at home where you can stay there so we can see your child. So that's what, looking back, I think having to have them in the office at first and then having all the hiccups we experienced, now we know why we got to experience those, because it helped to transfer it on.
So I heard another strategy you used was doing practice visits before having your scheduled visit with a physician. So could you tell me a little bit more about those?
Yes, we did. When we initially started, we contacted the families and actually walked them through how to do Zoom. We sent letters out to them to explain how Zoom worked, the app in which to get. And then we would contact them to practice to see, if they had any hiccups, if they knew how to get onto the site, and if their internet connection was actually going to work. And then we also, during that time, did our patient assessments. So we could go ahead and get a lot of the information gathered prior to the appointment and get that information to the physician. So it would help with the appointment process to help speed that up a little bit. And then, we would know beforehand if there were issues coming up. So that was one of the things we initiated. The families now have got so used to it that we still do some practices with our new families, or we have got it set up to where we even have a lending library now if we have families who don't have the appropriate equipment. So we actually send out an iPad to them with a card from AT&T, I think it is, if I'm not mistaken, in which they can actually have minutes that they can utilize, and they're not utilizing their own technology. So
we also give them hotspots if they're needed too, because we have 120 rural counties in Kentucky. So a lot of places don't have internet or don't have access to internet. So we send them hotspots, and that helps them as well.
So the next question I was going to go into is, what have been the biggest benefits from the family standpoint? And I know Sondra touched on this a little bit earlier, but is there anything else you'd like to add?
I can add something. I know that my families with autism, it's been a huge benefit for them, because so many of the kids with autism obviously have problems with change of environments and a lot of anxiety. So being able for them to be seen in their own home has helped them tremendously.
It has. And I think too, with neurology, especially with our children who have significant CP, who are CP quadriplegics, that it's really benefited these families, not having to get them, in their wheelchairs, get their oxygen hooked up, get their G2 pumps ready, and bring all of that equipment into the office where we can actually see them at home. And it gives us that window too, to see if there's equipment needs. You get to see that home environment, and sometimes you can just see like, oh my goodness, well, if they're living in a mobile home, then they can't have a great big huge Hoyer lift. We got to look at something else that's more appropriate for them. And sometimes, we put ideas out there and the families go for it, and then the equipment's not appropriate. But when you get to see it, you get to, make other suggestions. I think that has helped a lot too.
Well, I think it relieves the anxiety on the parent as well, not having to travel, because some of them have to travel a distance to see those doctors in person. And I think it just makes it easier for everybody, the parents, the kids, the other siblings, because if they're not in school, then, and they have to drive 2 or 3 hours, then, they have to bring all those kids with them, so I think it benefits everybody.
The financial impact, gas, traveling to just about anywhere right now. But, we've got families that could travel up to several hours, but still for even some families, a 30-minute drive, that's a lot,
Right, especially if the child's complex or if the
Absolutely.
child has autism and
Yeah.
I mean, there's a lot of factors that play into
Mhm.
that. And I mentioned that earlier. So yeah, money saves a lot of money and time.
It saves money and definitely saves, like you said, saves anxiety on behalf of the families, the parents, and the children.
And with Zooming too, especially with our patients who have autism and that may have the behavioral aspect going on and the struggles in school, we've been able to combine some of these medical appointments with the school environment too. And it has really helped the psychiatrist especially to see what is creating, because the family's reporting, well, we're this way at home, but we're this way at school. So what's helping to create this? And we're getting the teachers' perspectives. And even we had a meeting the other day in which the principal was involved, the guidance counselor was involved, 2 different teachers were involved, and we had all of them like sitting at a table, or the school did. And it was interesting to be able to see what are the triggers, what's gearing all of this, so then that we could start trying to make an appropriate measures of how we were going to get the treatment this child needed. So, it has just opened up so many other opportunities. We can get into the schools now a little bit easier. And
As Donna is saying about the school, we've done a lot of them where we've just done IEP meetings by telemedicine or by Zoom, and I think that really helps the families as well, because they know that everybody's going to be on there with them. Everybody from the school, they're going to invite us. We're going to be on there, and they can really look and see everybody's face on this screen together, so they can see the expressions and see what those people are, how they're reacting to what they're saying. And I think that's important, because you need to know how people are going to respond to you, and if you're sitting around a table, you're not going to see all those as well as you would see on a screen. You know what I'm saying? And I think that's an important piece, because sometimes the schools don't fall in line with what we think that the children should have and what the doctors might think the children should have. So, it becomes a compromise then, and then everybody can voice what they think is best for the child, and then we compromise, and then we set it into an IEP for that child. So we've done several of those, and those have worked out really well, because, we couldn't go to the schools to do it. So, that was our options. And I think that they're going to continue to do some of those that way as well.
So that's a great transition into my next question. What do you hope that you're able to sustain about the changes you've made to telehealth during the pandemic as we go forward?
I hope that we can sustain the library, the lending library that we have for the equipment for our families. I really hope we can do that and continue to offer them those cards to help with offset the cost of using the internet and the hotspots. I think those are huge. And I hope we can keep all the doctors that we've been using for those as well that want to continue to do that. I mean, from a family's perspective, I think that's, it's a wonderful opportunity for the families to, maybe possibly see the doctor twice a year on the Zoom, and then maybe once a year in person, because myself as a parent of children with special needs, there's sometimes that you do have to see them in person. So, but I think if we could financially continue to help those families that are in need, then yeah, I think we should keep doing it.
I agree. Absolutely. I think it's so beneficial. And I'd love the fact that we are able to lend tablets. I've used that service numerous times now, and it has been very successful. And, when COVID first happened, we didn't have that availability. And so I had kids on the waiting list for quite some time, but that has been really helpful.
it has. And I'm also liking the point with us doing what we're doing right now too, is reaching back out to the primary care providers and sustaining that they're seeing that we need them, and that the families are seeing that we need them. because we need them to do, weight checks, height checks, and different things in that too. So we're trying to pull that back out and let them know, what you're seeing here is a specialty provider, but your primary care provider is your home provider.
Mhm.
And that's what I hope to sustain too.
And I have one last question. What advice would you have for other complex care programs that are looking to expand access to telehealth for their patients?
Give us a call. We'll work with you. I mean, that's the only thing I could think of. It would be best for them to talk to the people that have been doing it if that's something that they choose to do, so that they could, start out right and not have as many errors that we might have had in the beginning, so.
And I would say go ahead and get started because, there's no sense in waiting any longer. It's here. The technology is available. We need to use it. It's safe. It's reliable, well, except for the internet issue occasionally, but, it's convenient. And right now, especially trying to help people, save every penny they can, is I feel like is really important. And I wouldn't hesitate to start. It kind of is overwhelming in the beginning, but people have really take to it quickly. And because everybody's so used to having smartphones, especially, it's not that big of a learning curve. And too, where the schools have been using, a virtual school and things like that, people have had to get more familiar with it. So I would say, don't wait, get started. And, like Sondra said, reach out. And we have learned some things, and we had a really good process in place when we first started. And it helped tremendously.
And if you don't try, you don't make a mistake. So try it. Mistakes are how you learn.
Well, thank you so much all for joining this call and for telling us more about Team Kentucky's telehealth program and all of the things you've done to improve access.